Good morning, everyone. This is part 2 of our series on emotional eating. We're going to be going over some tips and tricks for how to deal with it this morning. Last time we were able to discuss some of it, but we wanted to do it a little more thorough, a little more in depth, and in hopes of equipping you guys to help you out. So we're going to talk specifically in regards to our eating habits and what can take place after having weight loss surgery. As you guys know, everyone has a history with eating behaviors, and so once we have surgery, those things need to change, our habits need to change, our behaviors. And so the whole purpose of what we're doing this morning is to really empower you guys to be in control of your eating, and being able to manage your emotions in a proactive way. And this is going to help you be able to be more prepared to deal with cravings and head hunger, which is what we're talking about. So this is all about self-care, and we want to empower you guys to take care of yourself. So I want to go over some of the tips we started to talk about last time in regards to proactive behaviors that we need to be doing anyway, as far as executing, implementing self-care, like you guys taking care of yourself. One thing that's super, super important, we can't stress this enough, emphasize it all the time, is do not skip meals ever. That's one of the best tips that we can probably give you in that way. And as I like to say, you want to constantly eat ahead of your hunger. You want to give your body the protein that it needs continuously. As I posted earlier this week, you want to give your body what it needs before it tells you what you want. We never want to put ourselves in a position of compromise, because all of us know whenever we go 3-4 hours without eating, we put ourselves in a position of compromise. If I go three or 4 hours without eating, I'll eat this stack of papers, just throw some salsa on it, I don't care, I'm going to eat it. But I need to recognize that I put myself in that position. So we want you guys to stay as proactive as you can and be as consistent as you can in feeding your body, giving it what it needs. All right. The other thing that's super, super important too, as much as you can, control your environment. We need to be honest with ourselves as far as what our go-to foods are, what our weaknesses are as far as food goes. And we know if it's not in the pantry, if it's not in the refrigerator, then I can't go to it, right? So you want to make it, as inconvenient as possible as you can. So if you can, as far as your environment, controlling your environment, get rid of your what I call your go-to foods, the foods that you would go to, what you crave historically, what you'd go to cope with emotionality. That's super important. One thing we can't emphasize enough also is the importance of regular exercise that you need to be doing for yourself. Even 20 minutes a day helps, just to do something to be active. It's super important to make that consistent, make it part of your lifestyle, make it part of your routine, because it does. It really helps with our emotionality, helps us, being able to manage stress better, anxiety, depression, all that, and so we want to be doing these things on an ongoing basis. The next one, which I think is really important, we don't probably talk about enough, is we need to account for boredom. If you have too much downtime, too much idle time, most of us understand that can work against us, and that gives, our head too much time to think about things that we probably shouldn't think about. So we want to keep ourselves distracted in a proactive and a healthy way. So account for boredom, have things to do, avoid that too much downtime. Another great exercise or thing that you can learn how to do is practice simple, deep breathing exercises. You can look up some online. Just a very simple one is just to sit in a chair like I'm sitting in now. Breathe in through your nose, out through your mouth. You inhale, you hold it for a count of 2. You exhale through your mouth. You do that 4 or 5 times in a row. You're going to feel yourself relax. And what's good about doing or practicing this on an ongoing basis, when you do need it, when you are stressed out, like in the real world, you're able to have this skill set that you can access to help yourself calm down and help with your emotionality. So that's a great thing that you can do. Maintain accountability is really important. Stay plugged into community, healthy people that support you in your healthy behaviors, whether that's support groups or other bariatric patients that that are like-minded. Stay close to those guys. Form a support network. Develop a list of go-to people that you can lean on if need be, that you can text or you can make a phone call to if you need it. It's great to have those people. We need each other in that way. Stay plugged in, stay part of community. Another thing that you can do on your own or with a professional too is really sort out your history with food. To identify triggers in your environment, people, places, situations and make you want to eat, or make you want to crave like certain things. It's important to identify those things, so we know what to do with those things, and how to, as much as we can, resolve or reconcile those issues, so they have minimal effect over our lives. And along with that too, what I do with patients in my private practice, we talk about like changing old routines that are associated with food. And that's another great thing that you can do with a professional, to talk about your habits historically, and how not only how you used to use food, but when you used it, and in what context. And what I think is a really important issue to do as well, you guys, is resolve and reconcile relational conflict that affects you, to your ability. Really recognize your part, in any relational issue you have going on in that way. Because if you don't, that affects us more than what we think it does. Any of that unresolved stuff, and anything that's kind of, there's loose ends out there. Anything that's unresolved, we're going to have a need for control, and we need to recognize when we emotionally eat, we get some sense of control just by eating. Just hand to mouth gives us some sense of that. And so we need to, recognize our part and work on it to our ability. And what you can do on an ongoing basis too, if you don't already have one, have a journal or notebook, and really identify the emotions you're going through, that prompts you, that makes you want to eat, certain foods in that way. Is it depression? Is it anxiety? Is it relational conflict? And that, really develop that awareness. And that'd be another great thing to bring into a professional too, to go over those things, so you guys can develop a game plan on how to attack it, in addition to some of the things we're talking about this morning. And just a simple question, we talked about this last time too, we need to ask ourselves when we have the head hunger thing going on, where we're craving certain things, what is really going on with me in the moment? As I like to say, what am I feeding? Because I know I'm not feeding my body, I'm feeding something else. What is really the issue at hand here? What's really going on? And we need to recognize and develop the ability to recognize that stuff in the moment, because we know it's not about, head hunger is not the same thing as stomach hunger. We want to be able to make that distinction and make it clearly. Another good thing too that we're really big on here and promoting with patients too, is getting your labs done on a consistent basis, so to rule out any nutritional deficiencies that you may have, because they can add into some of the cravings, some of the hunger issues as well. So we want to rule out that the physical factor in that way. So make sure you're doing that. Do not ignore getting your labs done, especially that first year and a half post-op. You need to be doing that, to rule out those nutritional deficiencies. We have one question here we'll address right now. It says, I was an emotional eater and figured out after I had the surgery 4 years ago that I was hungry even during emotional times, so it was easy not to eat. All right, so that's a good comment. I was an emotional eater and figured out that after I had the surgery that I was hungry even during emotional times, so it was easy not to eat. So I'm not sure if she's saying...
She has a second part to that question.
Oh, there's a second part?
Yes,
okay.
It says, now I'm hungry a lot of the times, and not just during emotional times, especially at night. How can I tell if it's emotional or just hunger pains?
Okay. Well, I would do like a checklist. Ask yourself, when was the last time you ate? Because there's a rule out there, we've all heard it, do not eat after 6 p.m. in the evening, which I've never really agreed with, because if we stop eating at 6, we go to bed at 10, we wake up at 6 the next day, we've literally just gone 12 hours without giving our body any nutrients. So of course we're going to experience hunger at some point. And whether it's emotional or actual physical hunger, you want to make sure you want to go through that checklist, because if you've gone like more than 2 or 3 hours and it's late at night and you're hungry, it's probably both in that way. So you need to give your body something, but it's the content of what you give your body that makes all the difference. So again, you want to give your body some source of protein to help your body feel satiated in that way, so you feel that sensation of fullness. Because we know, if you guys think about it, not every calorie is the same. Most of the things we snack on historically tend to be carbs and sugars. Well, we all know whenever we snack on carbs and sugars, we want more carbs and sugars. That's why we can't have one potato chip. We can't have one Oreo. It doesn't work that way, okay? Protein makes the body feel fuller longer, so we know, we have to recognize that we need to give our body this substance, consistently in that way, okay? Hopefully that helps. So I have another question from last time we didn't fully address. And that somebody asked about the honeymoon. After the honeymoon's over, what do we do with emotional eating? And for those of you that are not familiar with the honeymoon, they usually talk about like the first year after surgery, where the weight comes off in bunches, and life is good for that time. What do we do with emotional eating? It's the same thing. And I really encourage our patients, that first year, as much as you can. We know you're not going to be perfect, but as much as you can, follow your surgeon's protocol. Cross every T, dot every I. Retrain yourselves, develop all these good habits, everything that we talked about this morning, as far as not skipping meals, staying hydrated, giving your body ample protein, all of those things, because the honeymoon period is going to be over at some point. And you want to make sure, I like to put it this way, there's literally going to be a point for every patient where their surgery hands them the baton to the patient, and your surgery says, okay, it's yours, you better run with it. And if we haven't prepared ourselves, if we put too much emphasis on the surgery to sustain our weight loss and health and not enough on our own behaviors, we're going to be in trouble. So we have to, that first year is so important to implement these good behaviors, start practicing those good habits, because that's what's going to sustain you long term, to sustain your health and weight loss. All right, I want to talk about some alternatives to emotional eating, and these are all the distraction tools, techniques that we can use to work in your favor. And so these are things that we can do in the moment when a craving does hit. And research shows us, we can delay, the craving or the urge to eat, 3 to 5 minutes, somewhere in there. We have a 90% likelihood for it, to go away. And so we want to, practice things, develop techniques that'll put us in that time range, to ward off the craving. We mentioned this earlier. One of the best things that we can do is simply phone or text a friend. Anything to distract yourself in that way. To redirect your thoughts. Say, hey, Joe, I'm having this craving. Talk me down from this. Talk me out of it. Why do I want this, or why don't I want this? Help me out here. Ask for that encouragement. Because we need to tell ourselves, you can't have the food that you're craving. Just wait. Just wait. It'll pass. We believe that. Once you experience it, it's a cool thing to experience. So another thing that I encourage my patients to do is physically remove yourself from the room where you're having the craving. So if the craving hits and you're in the kitchen, physically take yourself out of that room. Go outside, walk upstairs, just distract yourself to get you, out of that line of thinking, for that to go away. Another one is, I picked this one up on the internet. They said take your pet outside or just play with your pet. Again, it can be a distraction. So if I'm thinking about this over here, now I'm preoccupied with my pet in that way, that's going to redirect my thoughts as well. So anything you can do to distract yourself, again, do it. I like this one because I think it's a neglected sense that we have, is to light a scented candle. Again, something that's non-food specific. If you can choose a floral scent or lavender or something like that, just to kind of relax yourself and again, get your mind out of that craving. It's a great thing to do. And other things that most clinicians recommend, pick up your favorite book, pick up your journal to distract your thoughts, write something down, stay positive, play some of your favorite music. Hopefully you guys can develop, or hopefully most of you guys have like a playlist, like your go-to playlist, that you can put on to relax yourself and ground yourself out of that craving. Another thing you can do as well is view photos that are associated with positive memories. So you can do that on your phone, you can do a photo album, again, anything to distract you out of that line of thinking. But for the most part, if we're practicing the things that we talked about initially today as far as our proactive behaviors, not that that's going to totally nullify the cravings, but what it'll do, it'll help you be able to handle the cravings in a much better way. So you're going to respond to those in a way that you're not going to regret later on. You don't fall into that whole cycle of emotional eating. And the golden rule, I think this is really important to you guys. Do not address cravings with another substance. For example, healthy food. A lot of times people ask me, well, if I go to carrots or celery, or if I have a piece of gum, isn't that okay to do? You can do that, but remember, that's only going to reinforce the dependence on food to deal with emotionality. What we're trying to do after surgery is rewrite our history of using food to soothe and reward. That's what we should be doing from the get-go. As soon as we have surgery, is trying to rewrite that history. Now, when we use non-food means to deal with emotionality, you're giving food less power over your life. And that's really what we're trying to do all along here. You know, that's the goal, is to give food less power, where again we're taking control of our body and our life. Any questions? Okay. And I think we addressed the questions from last time I wanted. There's one other question too. It doesn't necessarily relate to emotional eating, but it relates to developing bad eating habits. One writer wrote in, do you believe that people coming out of poverty might have bad eating habits? And yes, that's definitely a possibility. What I've seen over the years is that people that come out of poverty growing up, as soon as they have the means and access, it's on. You know, over the years I've seen a lot of people, this is where they develop like the fast food eating habits, because maybe when they were a child they could never have it. Once they have the means and the access, they start to do this. It becomes a habit, it becomes a practice, and it becomes part of their lifestyle. So definitely that can play a factor for sure.
So what would you tell, what is your advice for patients that their family isn't supportive of their weight loss, of them having weight loss surgery, and after they've had surgery and they're trying to stay motivated with that negativity? What is your advice for them? Yeah,
that's a tough one. When you're dealing with a family that totally isn't supportive, supporting you and your healthy behaviors, there's a great classic book out there called Boundaries, and you know we use the term all the time, like in our field here. We need to set good boundaries with those people, and that's a boundaries issue. And the hardest people to set boundaries with is our families in that way, because they're the closest to us, they mean the most to us and all that. And what's scary about that, because they're the closest to us, because they mean so much to us, they have a lot of power over us and influence. So we really need to develop boundary setting skills with those folks, because the last thing we want to do is revert to our old behaviors and be ashamed if our family played in as a factor, in that whole deal. And that's really unfortunate. We see that often. And because it's such a complex, difficult issue to deal with, I'd really seek professional help, because it's a hard thing to do on your own, and you need an ally, you need a professional that can help guide you, in doing that, because that's a tough task. All right, guys, we appreciate your time. Thanks for tuning in, and hopefully these tips help you. What we're going to do later is post these probably on the Facebook page. So be on the lookout for those, and if you guys have any questions at any point, feel free to ask us, and we'll do our best to help you. Have a great week. Talk to you soon.
That was good.
Good. All right. Man, it goes so fast.